How's your morning been?
Yeah, it's been good. Seeing some progress for some patients who've been with us for a while. So yeah, it's been good.
Good. I've been doing diagnostic calls, and a guy said to me, "I want my life back."
Yeah,
That's kind of scary, isn't it?
yeah, it is. Unfortunately, it's quite typical, isn't it? I think of
Yeah.
people, new patients coming in.
It's kind of funny. We obviously review thousands of blood test results, and we've got thousands of patients under our care. And if you read the medical textbooks, you list the symptoms, and it's like they never present like that. So they present with, like, I've lost my life. I'm living, but I'm not existing. I'm treading water. Something is missing, and I can't put my finger on it. So, we know that testosterone affects everything, and then testosterone deficiency then obviously affects everything. Yeah. So it has a negative impact on so many aspects of life, and guys, they do just want their life back.
Yeah.
So if you were to sum up, say, the 4 top symptoms of low testosterone in order, what do you reckon they would be?
So the top 4 are mood, brain fog, libido, and fatigue and tiredness, isn't it?
And they're never in isolation as well.
No, yeah, of course, yeah. And there's so much overlap, isn't there?
Yeah, I mean, I saw a patient the other day, and he was talking about he wanted to improve his libido, and that was the primary reason for testosterone replacement therapy. And I was like, listen, that's potentially the hardest one to dial in.
Yeah, sure.
Because the other compounding factor was the fact he's had a history of being super stressed, and that's the biggest negative impact on libido.
Yeah, for sure.
So again, you have to address everything, and as men, we're so tunnel visioned, with testosterone dopamine dominant, which means we're goal driven. So it's like, I found a problem, go fix it.
Yeah.
But you have to look at everything, don't you?
Yeah. How do you find those patients describe that low libido? Because I think the thing I commonly hear is, mechanically I can get the job done, but the desire's just not there. I know I should want it, but I just don't. It just doesn't matter to me. Well,
it's interesting, isn't it? Because you would naturally assume low testosterone means erectile dysfunction, and actually rarely it does.
Yeah.
It might be lack of morning erections, but you're right. It's normally a low libido and possibly erectile dysfunction. So, yeah, I mean, this guy said, "Listen, I've got a hot wife. I should be more interested. If I see a hot girl walking down the street, I know I'm no longer distracted." And again, we're very primitive, simple creatures, us men, aren't we?
Yeah.
Fundamentally, we want shelter, food, water, bit of sex, and we're happy. So when you remove that, I'm joking, obviously, but we need purpose and meaning and value, blah, blah, blah.
Yeah.
But I mean, fundamentally, when you lose that, something's definitely wrong. But we live in that super stressed world, don't we? So, I mean, getting a libido and maintaining a libido just because you're on testosterone is unreasonable, because you've got to address everything, as we spoke about before. So if we think about what you said, brain fog, number 1 was your number 1.
Yeah, it's probably my number 1, I think. Yeah, for sure. And I think the reason for that's probably, selfishly, anecdotally, that's where I struggle the most, and it's what drew me to TRT. In the first place. And the analogy I've always connected with is, if it just feels like you're used to running on tarmac, and then suddenly you're running on in sand, in terms of how you process things, and particularly at work, that was the biggest one for me. If you're on a night shift at work in the hospital where I was before, then mistakes could be quite costly in that scenario if you're not thinking about things properly and processing things properly.
Well, that makes things even worse, doesn't it? Because the consequences of making a mistake as a doctor.
Yeah, absolutely.
Yeah. You cannot have brain fog. You need to be firing all cylinders. And again, testosterone replacement therapy is not going to make you an automatic admission to a Mensa. It's just going to allow you to have some mental clarity and focus. Because, even when I'm tired, I still have brain fog.
Yeah.
I drove to the gym the other day, and I went back to my home to get my headphones because I'd forgotten them, and I had a man look in the house, and I walked out going, I can't find us. They must be in the car. So I had a look in the car. I said, not in the car. So I was like, right, I can't have a man look. I have to have a proper look. And they were not in the house. And I walked out, and I glanced at my reflection in the mirror, and they were on my head.
Yeah.
I was like, because I'm so focused on everything else.
Yeah.
And bad night's sleep, that negatively impacts how you feel. So again, we have to go back to that foundation and then build upon that. But it's always everything. It's never one thing in isolation. And again, as men, we do tend to focus on just one thing. And I think that's part of our role, is to, again, give that objectivity in their subjective experience. But brain fog is a huge one.
Yeah. I suppose that example you used, part of that is the frequency to which that's happening as well, isn't it? So it's not an unusual thing. Everyone's going to have that. Like you said, if they've got a bad night's sleep or they've got lots on their mind. But I suppose if that's happening all the time, that can be a symptom of low testosterone. I remember that was what got me down. I used to consistently go around my house almost day to day, and I'd go to not a locked door, I'd go to a closed door in my house. I get my car keys and press the unlock, and it's just, what am I doing? But a one-off like that, you can laugh.
Lou's looking at you, just going,
yeah. But a one-off like that, you can say, okay, yeah, fine, I'm tired or whatever. But if that's happening all the time, that can actually have quite a big impact on your self-esteem and confidence in things like work and what you're doing day to day.
100%, and that actually leads quite nicely onto mood, because again, all of these things are interrelated.
Yeah, absolutely.
So mood-wise, how many of our patients have been to their doctor with symptoms of low testosterone, but they've obviously mentioned they've got low mood and they've been offered antidepressants?
Yeah.
It's scandalous, really, because again, they're looking to address symptoms, not the cause.
Yeah.
And fundamentally, as doctors, we should be looking to address the cause to make a sustainable change. But they get dished out these antidepressants like Smarties, and that's not the solution.
It's not even the solution for what I think the doctor who's prescribing is trying to treat as well. They're supposed to be there for short-term use to help get you through, whether it's psychotherapy or whatever it is, to get through that situation. Not for the years and years that we see patients on them before they come here.
Yeah, I mean, it's an absolute band-aid, isn't it? And I think it's a lack of understanding and awareness of the complexity of mental health. And again, I think as we say all the time, you can't outthink your physiology. If your physiology is dysregulated, talking therapies are not going to help you.
Yeah.
Talking therapies can only work when you've got normal physiology. And what's physiology? How your body functions. So to give an antidepressant and expect that to magically cure your mood, because mood's complicated.
Yeah.
I have down days still. I'm on testosterone. So, it's how you face those challenges. And again, we always talk about the glass half full, glass half empty. But it's like, if you treat that challenge as an opportunity, that's a win. But when you've got low testosterone, you see that opportunity, that challenge as a threat. And what does that do to your psyche? Absolutely mullers it.
Yeah.
So, again, you talked about low self-esteem, low self-confidence. You're constantly getting those knockbacks, and it's not the knockbacks from other people. It's that internal dialogue that's constantly going around in your head.
Yeah.
And I mean, I don't know about you, but with low testosterone, my negative thinking was off the scale.
Yeah, absolutely. And it became cyclical for me anyway, that low mood generated low mood. I was low about feeling low. I had, I qualified as a doctor, had a really great job, had, great wife and great situation, but I was feeling low just randomly on days, and that made me feel even more depressed.
Objectively, life is perfect.
Exactly.
But why don't I subjectively feel good?
Yeah. Or even just neutral, even just having it's just I feel actively bad about my situation, which is a really good one.
It's being able to appreciate the good days and learn from the bad days. And I think, when you go on testosterone replacement therapy, you think it's that quick fix that's going to undo all those wrongdoings that led to low testosterone. But as we say all the time, testosterone is the foundation and TRT is the catalyst for you to take personal responsibility and accountability for your actions to, again, address all those things.
Yeah, and I think that's the key point. I actually spoke to a patient this morning who I had to explain that TRT is not going to make life perfect every single day of your life. You're still going to have bad days, but you need bad days as long as they're appropriate for what's going on around you to appreciate the good days and when things do go right and still appreciate life in that way.
Yin yang, baby.
Yeah,
that's all about it. You can only have harmony with contrast.
Yeah.
I mean, we've spoken about this before, haven't we? About the fact that it can get that bad that some of these guys are suicidal, and whether it's just suicidal ideation or suicidal intent. I think it's quite scary that doctors aren't actually looking at low testosterone as a potential cause for low mood and increased suicide rates, because again, 3/4 of all suicides are in men,
Yeah.
and we get it easy. Do we? Does that doesn't make sense. If we have it easy, why are 3/4 of all suicides in men?
Yeah. And you're right. Arguably, that should actually be top of our list for, importance of these symptoms that do present, because a lot of the time maybe the patient themselves are actually ignoring all the other things that are going on because that's at the forefront. And if you're being told by a doctor as well, yeah, you've got depression, this is what we're doing, this is what we're treating, you might ignore the things about libido and fatigue and all the other things, put it down to this.
Well, again, fundamentally, I want to feel better. So, what does that mean? You know, that's a smorgasbord of symptoms and things that we need to be addressing. Yeah, I mean, I think for me, mood's the big one. So I would have mood number 1 and brain fog number 2.
Sure.
So I mean, again, number 3, libido or tiredness.
It's all relative as well. You need to, so fatigue and tiredness, I'd perhaps put before that, because libido can be a trickle-down effect of everything else falling into place. So fatigue and tiredness, again, if you've had a bad night's sleep, if you've been, if you run a marathon the day before or something, then it's
walk 100 kilometers.
Yeah, exactly.
And expect to be perky. It's like, no, that's not going to happen, is it?
But if you're doing all the right things, if you're sleeping well, you're recovering properly, you're eating well, stress is as regulated as it can be, then, and you're still feeling exhausted, and even just the thought of doing things is exhausting, which I can remember that as well from pre-TRT. That's not right. That's not how life's supposed to be. It's
as you said it's about treading in treacle. It's like treading water, like tethers swimming. You're trying, but you're going nowhere. And again, tiredness is such a vague symptom, isn't it?
Yeah.
There's over 100 causes for tiredness.
Yeah.
And again, it's looking to causation. And fundamentally, you can still get tired on TRT. By doing stupid things.
Yeah.
But
it's probably just knowing, it's that understanding, isn't it? That insight that, like you said before, that guy said, I just want my life back. It's because you're probably comparing it back to a time when things were okay. So you know what you can achieve. You know what you should be able to achieve with that level of sleep and that level of all the rest of it going correctly. So then when you suddenly can't do it, that's, again, all links in. That's going to negatively impact your mood and everything else.
But these are insidious changes, aren't they?
Yeah.
It's like these things don't happen overnight. So this kind of awful state seems quite normal. You're in that sort of purgatorial state, but you have a realization that something's not right. And we live in a stressful world, and the weight of the world will crush the best of spirit at times because it's quite perverse. And again, that leads not quite nicely on to number 4, which is perhaps libido.
Yeah.
And we all want to have a raging libido all the time, but actually that's when you're 16, that's quite distracting.
Yeah.
so I have to be doing other things as well. But I mean, having a healthy libido when you're nice and relaxed that should be quite normal.
Yeah. And the good litmus test is the thing you always taught me is what's your libido like on holiday? And that's such a good example, isn't it? It's a good kind of way to differentiate it. When you are nice and relaxed and everything, you haven't got the stresses of work and everything else. Is your libido normal? If it is, then maybe that's the answer. If it's not, then equally maybe that's the answer.
Yeah, I think it's unreasonable to expect to have a high libido when you're subjected to a lot of stress, whether that be voluntarily through your job or whether it be inadvertently through society. So yeah, the good litmus test is what you like on holiday, what you like at the weekend. If it's good, then you need to have a look at the stresses that are impacting libido, but then be realistic about your expectations, because again, TRT is not going to cure life. It gives you that foundation to allow you to put the work in to earn your reward. But fundamentally, that's really what it's about. But it's, again, having that level of objectivity in your subjective experience. And I don't know about you, but when I had low testosterone, I was super reactive all the time.
Yeah.
Irritable. I was like, fucking, I want this to be right. And again, when the guys come to us, it's like, it's got to be right. It's got to be right now. It's like, mate, it's a journey. You've got to trust the journey. You explain the journey, and you explain that, you might feel worse before you feel better.
Yeah, absolutely.
But we can promise you'll feel better if you put the work in.
Yeah, we're working on you in a year's time and what we need to do in the meantime, not next week.
Yeah, I mean, it's a terrible cliche, isn't it? But I mean, you know, TRT can be life changing, but in actual fact, life saving. But it's having that right attitude, and again, going to somebody that's going to be objective and somebody that you can trust, because there are lots of companies out there that are selling TRT as this cure or fix all. It'll fix tiredness.
Yeah, and it's hard because that's what you want when you're going through all this. That's what you want. You want something that's going to fix you, and it can do, but it's not going to be instant, and it's not going to be without putting in some work yourself as well.
Well, there's that level of desperation, isn't there? Because you know you don't want to be in this purgatorial state. You want to be better.
Yeah.
But it's not an overnight fix. And again, we talk about the earn your reward, and the reward being the determined effort that you put in. You have to understand that. You have to appreciate that. And it's like, this is not. If it was an overnight fix, it wouldn't be worth it anyway.
Yeah, that's the core of why it's so rewarding, because all it's putting in place is that you get back out of it what you put in, and that's how life should be, isn't it? And that's the core of all these symptoms. I think beforehand, you're just not getting back out of it what you put in.
Yeah,
and that's what kind of makes this kind of cyclical, particularly with mood, just driving you down, I think.
Yeah, I mean, fundamentally, our role is to optimize testosterone levels, but the reality is we're guiding people on their journey, and it's quite a privileged position to be in.
Yeah,
but
absolutely.
You can appreciate why it's so frustrating, because I want to be better now. We're men. It's immediacy. I've seen a problem. I know what the solution is. I'm taking the solution, but I'm not better yet, because life doesn't work like that.
Yeah.
You know, it's a constant journey, a constant evolution of practice and thought to go, right, okay, what do I want? I want to reverse the negative symptoms, and that's a given because you presented with those. But then then it becomes about leading a life worth living.
Yeah.
You know, what else can I do? And it's like, fucking go.
Yeah. I think that's the danger sometimes, isn't it? When you're driven on those changes, sometimes making TRT the absolute focus of your life, and it should just be, okay, that's sorted now. I'm focusing on all the other bits I need to focus on. So, living my life and getting all the lifestyle bits right as well.
It's when patients come in and, you know, they have their annual review and it says, how's your year been? And it's like, I'm coping. I'm coping better than pre-TRT. Now that sounds a little bit depressing, but it's not. That's an absolute win, because again they have that objectivity, and then they go, well, I don't even think about it, and I go, well, that's a win. I don't want we don't want you thinking about it. We want you cracking on with life. We're here to do that. We're here to sort the medicine out. Your responsibility is get on with life.
Yeah.
End of. Boom.